Hi, my name is Lindsay Tullis. My background as a nurse is I have been working for a little over 3 years now. Coming out of school, I got a job in a progressive care unit in a hospital, and it was a step down unit from a neuro ICU. So we trained with critical care experience in the ICU for probably about um, close to 2 months, and then from there went to a brand new floor that's never been opened before. So starting out as a new nurse, also brand new job in a new area, was very intimidating, but I learned a lot in that experience. I worked there for 2 years. We did a lot of vent weeding patients. Most of my patients would be trach vents. We would do cardine drips, insulin drips, and then we would also have a lot of floor patients. So the majority of our patients was a step down from the ICU, but too sick to go to the floor. So we did a lot of as well transfer and discharges on that area. So I worked there for a year and a half and did a lateral transfer in the hospital to surgery due to the progressive care unit actually moving to a different area. I looked at different areas in the hospital, and surgery accommodated with my schedule as well. So I've been there for about a year and a half now. It's very different from a floor, very different on patient care, and that kind of reassured me that I do love the one-on-one patient care, but I love a different side. I feel like I can do a lot of nursing opportunities and areas. I enjoy working with the surgeons and learning a lot about the actual anatomy and how to diagnose and treat surgically medical and patient issues. So I've been there a year and a half. Why I chose to pursue a nurse practitioner degree. So I have always wanted to be a nurse practitioner. And coming out of school, I knew that was going to be what I wanted to do. I worked at urgent care as a receptionist for 5 years while I was starting out in high school. So I've always had that. That was my kind of first experience as a receptionist, working alongside with physicians, nurse practitioners, and PAs, nurses as well. But I just saw the value and the way that they can improve patient care in larger numbers. So that's kind of where I saw I want to kind of pursue that degree. And I obtained my degree at University of South Alabama, which is also in Mobile. And I chose Auburn because, one, I'm a huge Auburn fan, so War Eagle. And on top of that, I think that it is a unique experience that I get a different degree at a different school and a university. It was very evident there that I wanted to go to Auburn, and I've heard great things about their program. So far, I have not been disappointed, and I have been very pleased with the amount of education and support we've gotten from them. So summary of my past clinical experience so far. My spring of 2020 clinical experience was at a primary care diagnostic and medical, which is a branch off of the hospital. We saw probably around 15 patients a day and stayed pretty steady. Learned a lot, and I definitely knew that semester I had a lot of work to do. This summer I was at a emergency room, actually a couple of them that were in kind of rural areas, and definitely absorbed a lot of information on, and it really improved my understanding of how to diagnose patients. And I'm still rusty on what to do after we figure out what's wrong, but I've learned a lot and improved my skills in learning how to figure out multiple differential diagnoses, what labs, what tests we're going to run, and hoping this semester I'm looking forward to working with women's health and peds and adults as well, and just kind of running and pushing all those categories together. I know they're all going to be different, but I look forward to really kind of seeing and watching my learning and education kind of grow with that. What I plan to do is it's kind of up in the air. I would love to do primary care. I live somewhat in a rural area in Irvington, outside of Mobile city limits, and there's a rural primary care clinic. I feel like there's a lot of opportunities there, and I would love to work in a rural area if able. I'm also kind of looking more toward, not really especially, but I do like orthopedics. But I also, being in the hospital this whole time, I've worked alongside a lot of hospitalists and people that worked in the hospital, like an infectious disease clinic. So the options I know are not very, they're basically unlimited, but I'm just trying to take each situation with a grain of salt and just taking all the information I have, and hopefully the Lord will lead me in the way that I need to go. I'll be at a rural area clinic in Alberta this semester for primary care, and peds probably in a rural area. Women's health is still up in the air, but I'm looking forward to this semester and looking forward to my knowledge growing, and really kind of hitting the ground running with trying to get as many clinical hours and ways to treat patients, and just learning as much as I can. So, thanks.